I'm Karen Feinstein, and this is Paul O'Neill. 20 years ago, we co-founded an organization called the Pittsburgh Regional Health Initiative, and our goal was to make the Pittsburgh region the highest quality, highest value healthcare provider in the United States. We haven't achieved that yet, but we don't give up easily. We keep trying. And we haven't been idle. So it's been 20 years of experimentation, demonstration. I think we've both made a lot of good friends along the way. We're wiser. We are definitely wiser and a little more sober now about what we can achieve and how quickly. But we want to share some of our lessons with others because we want them to take up the cause. We're not done yet. So starting 20 years ago, your friend, Dr. Lucian Leap, documented over 100,000 deaths each year from preventable medical error, and it was confirmed by the prestigious Institute of Medicine. Now the National Patient Safety Foundation has also documented not a great deal of progress, not what we all hoped for. Why has there been so much inertia? We do know you're quite famous for making Alcoa the safest corporation in the world and sustaining that excellence. What will it take to bring that kind of aspiration to healthcare?
It takes leadership, and it needs to be institution by institution. I think if we could write a law and mandate this, that would be wonderful, but it's not possible because organizations have their own culture, and unless the culture is supportive of what I call habitual excellence, you don't get habitual excellence, you get kind of a random walk where people are occasionally good, but not habitually. Unless an organization has that cultural characteristic of everyone matters, everyone is accorded equal respect and dignity, there's no way to create the underlying necessity of a system of learning, of continuous learning and continuous improvement, because people don't own the goal. We're not interested in just having the data. We want the data to show us that we're intentionally getting better all the time. So if you ask people, especially would-be patients or actual patients, is it okay with you if you happen to be one of the people who get the hospital-acquired infection? Nobody in their right mind would say yes to that. So what's the right number for things gone wrong in a hospital? 0. But unless the boards and the people in operating positions agree that our goal is 0, people will never get there. But you have to reach the hearts and minds of the people who are out there every day doing work. And it can't be, nuclear missiles from on high or threatening people with their job or any of that. It's got to be about positive, constructive leadership that causes people to learn, I can be part of something that's so big and so important, and I'm a contributor, and I'm recognized for what I do. And so it's not about a threat environment, it's about a reward environment where people do well and they're proud of it, and it spreads.
What made you think that when we, myself and 2 of my young colleagues, came to see you, you were well occupied as the chairman and CEO of Alcoa, and we asked you if you would help us found a multi-stakeholder collaborative, Pittsburgh Regional Health Initiative, to make healthcare safer and more reliable. Why did you say yes?
I was really attracted to the notion of using ideas that I was sure from my own experience in creating an injury-free workplace among 143,000 employees in 43 countries, that if we could use those same ideas with regard to health medical care, that we could create a demonstration effect for the whole country by raising the game in Pittsburgh. And it's why in our early conversations I said I was interested in doing this, but only if we included everyone. And so we started off, as I recall, with 44 hospitals, which were basically all of the major healthcare providers and the insurance companies and the big employers and the small employers and the insurance companies.
The Attorney General came.
We got everybody involved, including, at my insistence, which some people objected to, representatives of the media, so that we could educate them so they would stop writing sensationalist stories and be educated about the process of improvement. That was almost a game breaker at the beginning, because there were quite a few people in the provider community who were terrified about the media being involved. But we got started right, I think, with all of the legitimate participants with a seat in the room, which I thought could really propel us to a different place.
Do you have any moments that you remember during your time at PRHI that stand out as sort of happy moments, aha moments, things that you like to kind of carry around in your memory?
You know, so one memory, and I wish it had been replicated over and over again, was so powerful. I think it was true maybe 18 months after we got started. We had focused on central line associated bloodstream infections, and in that fairly short period of time, the 44 hospitals that were members reduced the central line infection rate 67%, if my memory is correct. That was an absolutely thrilling moment to see that together we could make this step change level. It was not a little bit, it was a gigantic improvement. And when you think about the human beings who were saved from, you know, at a minimum, extended stay and higher cost or death, it was fantastic. And it was, for me, a point that made the whole thing worthwhile. You know, that we demonstrated this works.
I remember, and I often say to people, if we hadn't been successful, I don't think PRHI would have survived. That was the point in time when people who had, I remember one really noted critical care doctor saying to you, hospital infections are just a byproduct of healthcare. Surgery, there's nothing we can do about it. And you proved them wrong, and that was the beginning. I also remember a moment when you brought in Kent Bowen and Steve Spear from Harvard Business School, and they drew this big spaghetti diagram of all the extra steps at Southside Hospital because one medication wasn't delivered on time. I think we documented 768 unnecessary steps.
Right.
And one of the chief nursing officers from a hospital jumped up and said, "That's my life."
Right.
I thought that was also a
It was a
moment,
really telling moment.
a moment to remember. For many of us working with you over the years, we were struck by your compassion. How concerned you were about people in Africa who couldn't get clean drinking water, and how much you felt for the families who had lost someone to a preventable medical error, and how much empathy you had for workers who got up every day and wondered, why am I doing this? You know, I don't even like the values of the company I work with. I don't even like the culture in my workplace. So the question you probably can't answer is how we create a more compassionate nation. I worry these days that we may not be going in the right direction, and somehow at the heart of fixing healthcare is also a compassion for the people who are dependent on that healthcare for their well-being, for their lives.
Yeah, I hadn't thought about it before, but maybe we should institute a new thing. We should create some kind of regulatory organization that certifies people as to whether or not they're leaders. That would be interesting.
It's very interesting.
Prove that you establish a culture and the important dimensions of integrity and respect are true for every employee. And if you can't do that, you're not a certified leader. So I'd love to give that test to a bunch of people I know.